Thank you, Mr. Bassett. I shall now invite the President of Kenya, His Excellency President Uhuru Kenyatta.
The President of the 74th World Health Assembly, Heads of State and Government, Dr. Tedros Ghebreyesus, WHO Director General, Honorable Ministers, ladies and gentlemen, we are pleased to be here at this historic regular session of the World Health Assembly, the first such assembly in person since early 2020, when the COVID-19 pandemic was declared a public health emergency of international concern. I wish to take this very early opportunity to applaud the efforts of all the nations represented here today for the bold and decisive actions taken collectively and with your respective national contexts to address the greatest health emergency that has been witnessed in our lifetime. In this year, commemorating the healthcare workforce, I would be remiss not to mention the dedication and commitment of all our health and other essential workers throughout this crisis. Throughout this pandemic, WHO has been instrumental in galvanizing the actions of governments, scientists, development partners, and the public in taking actions that were needed to contain the transmission of COVID-19. Here again, I commend the Director General, Dr. Tedros, for his exemplary leadership and commitment during one of the most challenging periods ever experienced by WHO. This would not have been possible without the consistent commitment and exceptional expertise, and indeed the sacrifice demonstrated by the entire Secretariat. Throughout the crisis, Dr. Tedros provided strong, clear, and collaborative leadership, and these qualities persuaded the World Health Organization membership to make Dr. Tedros the sole candidate for re-election, a stand which our country, Kenya, strongly supports. As we seek to recover lost time before the 2030 deadline for the Agenda for Sustainable Development, it is our desire that the Secretariat will continue to experience the same level of unity and success. And for this, you can count on Kenya's support. Madam President, as member states, we relied on WHO to provide the most up-to-date information and technical guidance on this novel virus, and to guide us as we implemented national mitigation strategies. Just as we depended on WHO during the early days and months of this pandemic, WHO is now counting on us member states to provide the same lifeline through the provision of sustainable, predictable, and flexible financing. During our tenure as chair of the WHO Executive Board, Kenya has been inspired by the determination of member states to address the long-standing issue which has been highlighted by multiple review panels. I therefore urge this Assembly to take the first bold step towards a better resourced and authoritative WHO. I'm also pleased to note that the G20, which is meeting soon, is prioritizing the financing gap for pandemic preparedness and response through the establishment of a financial intermediary fund. To ensure its success, I would recommend that equal participation by developing countries should be considered within the governance and decision-making framework for greater legitimacy and buy-in. Madam President, the theme for this year's Assembly is appropriate and also timely. Health for peace and peace for health. Indeed, this phenomenon is not a new one, as is evidenced by one of the principles of the WHO Constitution, recognizing, and I quote, "The health of all people is fundamental to the attainment of peace and security and is dependent on the fullest cooperation of individuals as well as states," end quote. The challenge, therefore, is for us as leaders to determine to what extent health is being used as a tool or a bridge for peace, and conversely, how we can recalibrate our policies to recognize the centrality of peace as a key prerequisite for health. I wish to commend the work of WHO in this area under the Global Health for Peace initiative as part of its contribution to the maintenance or restoration of international peace and security. The unfinished work of the SDGs, compounded by the multiple crises such as conflicts, food insecurity, escalating energy prices, and the consequence of climate change, demand a WHO that is fit for purpose. Enhanced technical and financial capacity of the WHO, particularly at country level, is key if the WHO is to successfully leapfrog member states closer to their national health-related goals aimed at a highly dynamic and challenging environment. We especially welcome the launch of key initiatives such as the WHO Academy, the WHO CTAP, and the related mRNA manufacturing hub and spokes, which will contribute to strengthening or establishing biomanufacturing capacity within developing countries for greater resilience. The COVID-19 pandemic necessitated the rapid development of diagnostics, therapeutics, vaccines, and other global public health goods. The pandemic also exposed the necessitated dependence of developing countries to external markets, thereby hampering efforts to ramp up production of the necessary health products as well as technologies. To support the sustainability of new manufacturing initiatives, all stakeholders must come together to address the financing, coordinated technology transfer, including affirmative action, as well as market access for locally manufactured products. Going forward, we would urge Gavi, the Global Fund, PEPFAR, and other major vaccine and essential medicines purchasing organizations to lead the way in prioritizing procurement of these locally manufactured health products from the countries they serve most. We call on WHO to promote the success of these manufacturing plants through supporting regulatory systems, strengthening the expeditious pre-qualification of these locally produced products, ensuring market access and procurement for the finished products from these spokes. Madam President, Kenya is pleased to have been selected as one of the MRA spokes, which will complement the WHO Emergency and Logistics Hub in Nairobi. Through the Africa CDC, Eastern Collaborating Center in Nairobi, we are committed to building the necessary capacity in Africa for health emergency prevention, preparedness, and response, and we stand ready also to provide and surge capacity in other countries when called upon to do so. Madam President, the current pandemic has revealed the level of inequality across the world. From the global level, the national level, as well as the subnational level. No country or sector has been spared from the devastating impact of COVID-19. And this is especially true for developing and least developed countries, which are more vulnerable to economic shocks and disruptions to global supply systems. As each country plans its social and economic recovery strategy, it is important to focus our collective attention on the very real risk and impact of an uneven economic recovery and what this portends for our long-term pursuit of ending inequality amongst countries and peoples. Indeed, in the words of the UN Secretary General Antonio Guterres, COVID-19 is the biggest moral failure of our lifetime. As we speak, 1.8 billion people in low and middle-income countries have yet to receive their first dose of COVID-19 vaccine. While the availability of vaccines has improved significantly, lack of political commitment early on in the response has left many countries confronting vaccine demand challenges which are sometimes compounded by operational and financial constraints in the rollout of vaccines. The various review processes at global, regional, and national levels have pointed clearly to the shortcomings of the prevailing health architecture and its inability to adequately protect those who are weak and most vulnerable from catastrophe and devastation arising from pandemics. This is part of the reason why in March of 2021, I joined other global leaders to call for the development of a new international treaty for pandemic preparedness and response to increase global solidarity and to promote equity. As a trusted partner to many countries, WHO must remain central to the global healthcare architecture as we move forward. Madam President, it is undisputed that COVID-19 pandemic has presented challenges that have eroded significant gains towards the realization of the Sustainable Development Goals. Disruption of health service delivery have negatively impacted programs dedicated to maternal and child health, immunization, HIV, TB, and malaria, non-communicable diseases, amongst others. As the chairperson of the African Leaders Malaria Alliance, I would like to highlight that in 2020, there was a rise in the global burden of malaria with an estimated 627,000 deaths and 241 million new cases of the disease. No single tool that is available today will resolve the problem of malaria. I therefore call for greater investments in innovations for malaria, TB, HIV, and other neglected tropical diseases. Innovations that will bring about new disease control approaches, diagnostics, medicines, and other tools to speed the pace of progress against these priority diseases. As one of the malaria endemic countries, Kenya, together with Mali and Zambia, are currently piloting targeted sugar-based products intended to prevent outdoor malaria transmission. Kenya was also instrumental in the development of the malaria vaccine and is one of the 3 countries to pilot its use alongside Ghana and Zambia. Indeed, in my inaugural speech of 2017, we did announce my administration's Big 4 agenda for economic development. And among these was the promise to attain universal health coverage by the year 2022. In addition to food security, affordable housing and manufacturing, but to attain UHC, my administration, with the invaluable support of the WHO, has undertaken major policy and legal, as well as administrative reforms within our health sector. To ensure successful implementation of UHC, and in partnership also with the private sector, my administration has also invested in health infrastructure and development of a digital health platform to support the effective monitoring of our health sector. With regard to maternal and child health, Kenya's Linda Mama program has improved the provision of high-quality maternity delivery services in public health facilities, and this for free. Other subsidy programs have also been implemented for older persons and persons living with severe disabilities in our country. While much progress, therefore, has been made, we continue to work with our development partners as well as our private sector partners to address challenges related to shortages of skilled healthcare workers, low insurance coverage for the population, inadequate financing for health, inadequate infrastructure and equipment, disparities also in access to services by geography and populations, as well as emerging external threats such as climate change occasioned by global warming and other geopolitical threats. These challenges are not unique to Kenya, and we continue to observe the same trends across the world. Additionally, we have witnessed a sparked rise in the prices of food and fuel, affecting developing and least developed countries the hardest, and yet we have no role in this particular crisis. The World Bank projects that global growth will slow down from an estimated 6.1 percentage points in 2021 to 3.6 percentage points in 2022 and 2023. In the Horn of Africa and Sahel, 20 million people are also at risk of starvation due to 4 years of prolonged drought and failed rains. To be able to effectively mitigate against the negative impacts of these pandemics, we require the concerted efforts of all players within the multilateral setting. Madam President, I say all this to emphasize that we are one people, interconnected, and with a shared future. No country is immune, and no country, however well-resourced, can do this alone. We must therefore foster greater cooperation and collaboration to find lasting solutions to the challenges facing our generation. This will set us on the right path towards sustainable development and attainment of the highest standards of healthcare to our people. Nationalism, fragmentation, discrimination, exploitation are not the ingredients for the world we want for tomorrow. More than ever before, we must all recommit to the principles of the UN Charter and empower our multilateral institutions to assist countries to respond to present crises, rebuild our economies and societies, and address climate change and its impacts. In conclusion, I wish to once again underscore that the foundations for building a better tomorrow must be laid by all of us today. Every one of us here has the power to shape the next chapter in our common history and our common destiny. Let us, without hesitation, take bold decisions and actions to ensure that we realize our common aspiration to promote health, keep the world safe, and serve the vulnerable. Together, let us ensure that we have a legacy of cooperation, solidarity, equity, and inclusiveness, and I am more convinced that this can happen, and my friends, it is within our reach if we do work together. I thank you all for your attention. Thank you.